Maura?
Well, I think that it is partnerships, and I think it's a whole variety of partnerships, as Tom said, where the way we are changing is also changing. And so what I would encourage everybody in this room to think about new ways that you'd like to work with us, and that you think that you could leverage our assets and that you would bring something to the table. And that's what we'd like to do, is to have that dialogue, Jeff, and invent those new ways. And I think you're absolutely right on all of these things, but particularly I think we have to work on figuring out how to scale up these innovations that we have already found, because that's a much more complicated thing than I think any of us realize. So come talk to us, and let's invent new ways to work together.
Great. Well, that is a great segue to open this up to conversation with all of you. We have some microphones we'd love you to avail yourselves of if you'd like to ask a question or make a comment. And if you would, just identify yourself by name and affiliation for the benefit of the panelists, that would be terrific. Let's see, I think we've got one right down here in front. Okay, we'll start in the back and then we'll come down here to the front.
Thank you very much. My name is Aaron Elmer from PATH. I really appreciate the comments of all the speakers. To kind of recap one of the things I heard, I know that everyone was speaking about the importance to the administration of research and development for science and technology in development. And knowing that there were some different ways this was described, there was also a lot of discussion about USAID's role specifically, such as private-public partnerships, the ability to assess the needs and engage the stakeholders and the end users on the ground in research and development needs, the cultivation of in-country capacity for science and technology R&D, and also the need for a whole of government and perhaps whole of society approach. And based on these ideas, I'm wondering, what are the recommendations that we can give specifically to the Congress as it's thinking about the foreign assistance reform process? And what are the other ways that we, either on the administration side or we as NGOs, as citizens, can be engaged in supporting the foreign assistance reform process? Thank you very much.
More. Tom, you want to start?
Well, I think one thing that's challenging is that there are so many opportunities that it's difficult to know where to start. And so I think one thing that outside organizations could help with is to try to help with some prioritization. Certainly in the field of public health, there's a long tradition of identifying the different interventions that we know about and trying to figure out what types of interventions will have the biggest impact in terms of life years saved per dollar. And so the question is, using some of the methodologies for the evaluation of research and development, like the real option theory, for example, could you come up with ways to help the administration prioritize? Because obviously we're entering an era where we're going to have to be placing a greater emphasis on deficit reduction and fiscal responsibility, and so we won't be able to do everything at once. So some thoughts about what's an evidence-based way to engage in priority setting, I think would be very helpful.
I think that's great. I just add one to that, and that is more flexibility. So I'll give you an example. In Zambia, the country, AID's budget is $300 million, and the mission director has discretion over $1 million. That's a third of 1%. And so if you think about the budgeting process, we're starting in the F-12 now, and by the time it gets through all of Congress, et cetera, you take all of that out, so it's not even able to be responsive in terms of the kinds of developments. So you see this vaginal probicide, we're really excited. Well, how the heck? We didn't know that existed 3 years ago when we were doing the budgeting process, and it's and we have it specified down to almost the last dollar. So where I think you can be helpful is also understanding that innovation in science and technology, we need what Tom says, new tools that you can help us with prioritizing. We also need the flexibility when there is these opportunities for new innovative public-private partnerships, where there's opportunities where we see a really fantastic new development, we have the flexibility to shorten the cycle of distribution because we can put our hands on some of that flexible money.
What, to pick up on this whole issue of earmarking and the context of foreign assistance reform, obviously what you're getting at is it would be great to have fewer earmarks, more flexibility. But flexibility can't come without accountability. So USAID would still have to be held accountable for meeting certain goals. How would you see that working in the context of foreign assistance reform so that Congress will have a clear sense that the agencies are accountable for taxpayer funding being spent on these ventures, but also that flexibility to respond in a way that is not possible with the heavy-duty earmarking constrictions?
I think we are building real capabilities in monitoring and evaluation. So that's part of it, is you've got to have the tools in place to even pose, let alone answer the questions that you described. And the second thing we need to do is we need to say, why are we doing this anyways? And so we take like we did vitamin A supplementation, and we discovered that if you gave a newborn a dose of vitamin A in the first 48 to 72 hours, that infant mortality is reduced by 20%. So if what we're doing in global health is trying to reduce maternal mortality, reduce infant mortality, it's a scary thing to say, we're gonna hold you accountable for that, but that's a much better way to go about it. And for us to be honest about our successes and our failures along the way around that. But I think it's to kick up the problem to a higher level so that you can create the kind of breakthroughs and innovation that really imagines big leaps in a way that you never thought on these end goals.
Let's see, we'll take a question here and then we'll come over and pick up these two over here.
Hi, I'm Eileen Flynn with PATH, and I too appreciate all the comments from the panel. I wanted to take Laura up on her offer, to offer a suggestion, which has to do with late-stage trials. NIH typically isn't involved outside of HIV. It tends to see their role stopping at basic research with industry coming in and taking the product forward. But when industry doesn't perceive a market, the product may just sit on the shelf. And so there's a clear gap there. And as we think about flexibility and we think about roles of additional kinds of research beyond what is clearly NIH's strength, do people see a role for a USAID in providing that?
I think that's a great suggestion. We ought to follow up with this afterwards and see how we might be helpful in that.
Over here.
Thank you. My name is Jeff Meir. I'm with the Public Health Institute, which, as some of you know, is both a research institution and an implementer in the field. And I wanted to talk for a moment about the field, because we talked a lot about inside baseball here in Washington and how we make policy and what the right combination of agencies is. But when it boils down to it, a lot of the really good work won't happen unless we can make things move out at a field level. One of the big constraints that folks who are trying to get technologies in the field utilized are barriers in country. I know, for example, of some very good examples of technologies, vaccines, that have waited years to get through a particular Ministry of Health, or a technique that has come online, but simply the uptake in a country has been blocked by a particular bureaucrat or agency. And so it brings to mind the question of whether our government is really equipped at our embassies and our missions to do the kind of health diplomacy that might be helpful in getting some of these barriers removed. If USAID is going to have a technology that it really believes in and has invested a great deal of money in, and if the private sector is behind it in an important way, doesn't it make sense to make sure that our ambassadors, our mission directors, and some of our key staff in embassies and missions have the technical ability to be diplomats for these technologies? Thank you.
We don't have anybody here from the State Department to speak directly to that, but Corey?
Yeah, I think I can speak to that, and I think, you know, there's a couple of issues. So one of the things, this concept of roadblocks, I mean, we've been accustomed to many of them, but I think that there's generally something behind these roadblocks, and when you see this sort of, something isn't moving, I mean, essentially what that means is that it's not a priority to that country. Now, the question of why it isn't a priority to that country can come from a lot of different reasons. So maybe there's not a level of understanding that that's actually an important problem. And again, I'll just go back to what I know, which is cancer in Uganda. But when we first started working in Uganda, the Cancer Institute actually got no money from the government at all, zero. So
This is the Ugandan Cancer Institute.
from the Ugandan government, no money to run it. So essentially there was no prioritization, and the people had this notion that cancer wasn't an issue. Well, what happened, unfortunately, was that a very high up minister in the government developed cancer, went to the Cancer Institute, and died on the cement floor with no treatment. And all of a sudden, people said, well, wait a minute, I know something about cancer, and cancer became an important issue. Now, at the time, we were there, not in any official role, but we were there as our role as medical educators and researchers, saying, well, here are the data as to why this is such a problem. Well, through that, I think the Ministry of Health said, okay, wait a minute, now we understand cancer is a problem. Okay, so now what do? Can you help us develop a comprehensive cancer control program? Can you help us think about strategies to deal with cancer? But when we had gone to the government previous to that and said, let's work on cancer, they were saying, well, no, we have $250 million here to work on HIV. That's really what's important in this country. And it's not our role to say that HIV isn't what was important in that country, but it's our role to say, actually, we need to do some education here and some work around and understanding of what are the true priorities. So I think, again, it comes back to this concept of partnership. We've worked very closely with both the USAID and the CDC directors in country. And I think that to some extent they're in an awkward position. One, they need to be, they themselves need to sort of get a little bit of an education as to what are the important, let's say, global health priorities there. But then they also need to find counterparts in the local government and understand what they think the priorities are. And then there needs to be some sort of a summit or sort of like a reconciliation, that allows this sort of bill to sort of move ahead. And so I actually see this as a challenge for all of us to say, well, how do we do, how do we take these things? How do we show that mobile telephones doing banking is actually something that's of value? And once you can show that, and it's recognized locally, and it goes both ways. I mean, I think, when I go around saying I work on cancer in Africa, people are like, what, are you crazy? I mean, that's not even a problem. So, I encounter that here in the United States. I encounter it also in Africa. So I think if we can sort of rise the tide, float all of the boats, make people pick out these technologies, be it mobile banking or be it cancer and infectious disease, and make people understand why they're important, and make people understand why they're important to people in this country as well as, because I think that's something that is another dirty secret of foreign assistance that we haven't really talked about. I mean, essentially, this is all funded with US taxpayer dollars. And there's a little bit of a, well, what's in it for me? Okay, so yeah, they have mobile banking in Kenya, but what does that do for me? These are my tax dollars. And I have to say, I understand that. I mean, I'm not as sympathetic as to other people who maybe, more wanting to follow every tax dollar. But I think that we owe it to people to sort of say, well, here's how this works. This is why it's important to us in the United States. This is why it's important to you in the local area, and really sort of have an understanding about that. And then I think you see these roadblocks, fall away.